Good evening and welcome to the Ombudsman program. My name is Diane Welborn. I'm the Ombudsman and I'm going to be the host for this evening's program. Tonight we're going to be talking about a subject that has really changed many lives in the past year, and that is the impact of COVID on, in particular, our Ombudsman advocacy work for residents of long-term care facilities. So in the process of discussing that, we will also be discussing all of the impact that the COVID pandemic has had in our long-term care facilities and assisted living facilities and group homes. And it has had an enormous impact. I am joined this evening by my colleague, Lawrence Wilkins. Welcome, Chip. He goes by Chip for the viewers.
Thank you, Diane. It's great to be here.
That he is our long-term care program director. So I'm going to be firing the questions at him this evening. And if you have questions, you can call in to DATV and they will relay the questions to us through the chat function on Zoom. So please call in if you have a question about anything that we're speaking about tonight. Chip, let's start by informing, the COVID hit so hard in our nursing homes where the health of the residents is already compromised. In fact, we first were shocked and horrified at this time last year when we learned about the high number of deaths and illnesses in a long-term care facility in the northwest part of our country, which was highly publicized, and it shocked the country and actually was a significant step in revealing the highlight of the epidemic that was already in our midst. So let's start, Chip, by informing our viewers what the responsibilities of long-term care ombudsmen are across the country.
Great, thank you. I sure will, Diane. Ombudsmen are primarily created through the Older Americans Act, which is a federal statute that came out back in the 1960s, actually 1965, and it was pushed through Congress and ultimately signed into law because of the fact that so many individuals were dying in nursing homes or they were suffering just horrible care. So the government decided that they needed an advocate, and ombudsmen across the country were created. In fact, every state is required to have a long-term care ombudsman. And what we do is we advocate for residents when they have a complaint about some of the services they may be receiving in the facility. We are also, in addition to nursing homes, we, as you mentioned, we're in assisted living and adult group homes, and we are there also advocating for residents. And we actually step into the shoes of the resident and we make their argument our argument or our complaint, and we advocate for the change they want. But that's just one component of what we do as ombudsmen. We are also here to help in what's called the selection assistance component of finding a nursing home or an assisted living facility. Many of us go out, and the first time we start to look at nursing homes or assisted living facilities, we're overwhelmed because we're stepping into a pasture that we've never been in before. It is completely new. The language is new, and we feel really out of place. So the Ombudsman's office is here to help kind of bridge that gap and make it not so cumbersome or intimidating. And that's a large part of what we do. We also, of course, need to keep a regular presence in these facilities. So we respond to complaints, we help people choose the right facility for them, and we maintain a continuing presence in these facilities. And what I mean by that is we try and be in the facility, a nursing home or an assisted living facility, at least once a quarter. So 4 times a year, we are there, boots on the ground, walking around talking to residents. Um, and that is really what we have used a lot of our volunteer ombudsman for over the years to keep that continuing presence. It is an incredible uh, job that our volunteers do, and it is really what keeps us connected day to day. So prior to the pandemic, that was what we did. We had the complaint handling, the selection assistance, and maintaining a presence in the facilities.
Right, and just want to highlight for our viewers that many residents of long-term care facilities are not able to call out to our office if they have a complaint or concern. So that's why it's important for us to go to them. Every nursing
Absolutely.
home, yeah, every nursing home, of course, posts our 800 number, which is very helpful. But some of the residents have trouble dialing the phone or placing that call. So that's why it's important to have people actually in the facilities reaching out and reminding residents that there is an advocate ombudsman for them. Because the population of the facilities is ever changing with admissions and discharges, and so there's always somebody new in there that we need to meet and speak with. So, but prior to the COVID outbreak, there were infections in our world, and probably the biggest one that hits hard is the flu. So why don't you let the viewers know what the practices were to try to reduce the risk of infection prior to COVID?
Absolutely. The facilities would take steps to maintain a facility that is free of infection. And typically, as you were coming up on the flu season, the nursing homes would follow a standard protocol that they have. And this protocol has been developed over the years. And it wasn't something they woke up one day and said, we're going to take these steps. It has evolved over time. And what they will do is, first and foremost, they will make sure that any of the residents that want to have a flu vaccine, that they are offered that opportunity to have that. Secondly, they go through their staff and they truly give them a reorientation every year of what is proper protocol during a high viral season like the flu. And what that means is they are reminding their staff to make certain that they utilize hand washing after every visit, that they are wearing the right protective gear given the outbreak that may or may not be in the facility. But normally, if there hadn't been an outbreak, you won't see a lot of the protective equipment on. But what you will see are facilities that are extremely clean, or I should say they ought to be extremely clean, because they do a lot of disinfection of the facility. But I think one of the most important things that they will do is they have a system for keeping those residents they know that are ill in an area where they do not have exposure to other residents. It's a type of short quarantine period for the residents. And that is something that has greatly expanded during COVID. But additionally, they will every day check the symptoms of the residents, take temperatures, and monitor their vital signs a little more closely than normal, and then putting that all together when they do have individuals that are ill and may have the flu, then they are segregated or put in quarantine area to keep the rest of the residents safe.
Very good. Well, a year ago, this month in March, when the governor of Ohio actually closed visitation to nursing homes, how did the facilities react to that closure?
Well, they, like all of us, I think that they were dealing with the shock of the pandemic, and I always remember thinking that this is just, the whole world seemed bizarre at that time, and it's kind of used to it. But at that time, facilities were feeling the same anxiety that the rest of us were in not knowing what was going to occur. But I will tell you that facilities learned pretty quickly the importance of following the order of the governor and Department of Health, because we did have an outbreak in a facility in our region. We were one of the first, if not the first, nursing home in the state to have an outbreak. And part of what we have learned since then is that the outbreak was actually not confined to just that one facility. It went to a neighboring facility where individuals had traveled from facility A to facility B and took the virus with them, which is part of why it was so important to keep visitation as minimal as possible, because every person that came in was presenting a new risk of exposure to the virus. And that's kind of how it, real quick, and when I say quick, I mean within a couple of weeks, facilities understood that every time a new individual walked through the door, there was a heightened risk of exposure to the virus. So I would say that they were confused and bewildered at first, like all of us, but quickly the facility took the steps of closing the doors to visitation, primarily to keep their residents and staff safe.
Right. Did all of the facilities react in the same ways, or did we see a lot of differences among facilities' response to this?
That's a great question. We did see a lot of variation in implementation of the order from the governor and the Department of Health. It was not a law per se, in that you couldn't look in the Ohio statute and find this rule about COVID-19. This was unique to this point in time. So it was an order that, for the most part, is followed to the letter by facilities, but there's gray areas and there are interpretations that differ from one facility to another. For instance, we had a lot of facilities early on only wearing surgical masks, and they did not utilize the N95 mask. We had facilities that did not allow any visitation whatsoever, but then we would have some facilities that were trying to go out of their way so that family could visit, even if it was through a window, or I remember one, and this was as late as June, where they were still trying to get family and the resident together in a centralized location outside, which was at that point thought to be the safest area that they could meet. And then when you compare the nursing homes to even assisted living, we had some assisted living facilities that were going about their normal visitation that really didn't change a whole lot until, of course, they ended up with a COVID outbreak. And I will say what surprised me the most about the COVID-19 pandemic is that a lot of facilities were not following the orders, particularly on visitation, until they themselves felt the effects when staff were impacted or residents were impacted. And we were constantly telling the facilities, no, you need to follow the recommendations, because if you don't, it's not something you can be cavalier with. These are folks that are already at a vulnerable state in their lives. And if they, the risk of dying is extremely high, as we have seen.
Yes. We have a caller or viewer that has given us a question here, so I'll give that to you. The first is, how often are the high traffic areas cleaned a day in a nursing home? And then a follow-up to that is, how can I find out if a nursing home is safe from COVID for a viewer's mother? So those are two. One is about the cleanliness in high traffic areas and how frequently. And the second is how to ensure that it's a COVID-free facility.
Well, that's really good question, and I will tell our viewer that the high traffic areas at a minimum are going to be cleaned at the beginning of every shift. And most facilities work on a 3-shift working day, 3 8-hour days. However, if there are increases in traffic, or if there is anything out of the norm, they will do it more frequently. And in addition to that, cleaning in the high traffic area at the beginning of each shift, all of the surfaces that hold notebooks or files, anything where you can lay your hands on, they are supposed to be cleaning that with a 99.9% disinfectant, that surface, every time that someone has touched it or is exposed to it. Likewise, I saw a lot of facilities that if there was a high traffic area and people have gone through and something other than their feet touched the ground, whether there was a fall or they were utilizing their own internal system for checking how residents are doing, and they may congregate in that area, there would be a need to clean it much often than just the once a shift. And really, you can see that even today when you go into facilities, that if we touch an area, they will typically clean it so that whatever might have been on my skin can't be transferred to someone else. And then the
Okay, and
pardon me? Yeah, I was going to go on to the second question. And can you repeat what that was, please?
Of course I can. The viewer wants to know, how can one be assured that the facility is free of COVID before sending a loved one into that facility?
All right. The way that you know whether a facility is safe, and by that I mean they have no active cases of COVID in the building, you can go to the Ohio Department of Health website. It's ODH, and you go to the coronavirus dashboard. So remember, Ohio Department of Health. If you just go to that website, there are big signs on the website that point you in the right direction. If I can get there from the website, I think most of our viewers could too. But look for the COVID-19 dashboard. When you are there, it's up on the top right half of the page. It says long-term care facilities. If you hit that, it breaks the long-term care facilities down by county. So if you were looking for a nursing home, let's say in Montgomery County, and you wanted to know if they had any active cases, you would go to that site, look through Montgomery County on the dashboard, find your facility, and they're in alphabetical order, and then scan across, and there are columns, and it will show you the active cases for residents, then the total number of cases since the pandemic started, and then it does the same thing for staff. What are the active number of staff out right now with COVID, and what's the total number? But what we are looking for is the active current number. If that is 0, then it is presumptively safe and free of COVID at this point in time.
Right. And they could also ask, of course, the admissions and the administrator, if anything has changed on that dashboard, just to for their own security there. I wanted to ask also, did we see staff working in nursing homes leaving because of COVID, because they were at an increased risk as well?
We did, Diane. We saw a true crisis early on in facilities that were experiencing COVID, particularly for the first time. And it was not uncommon, and I will say this without using names of facilities, but there were, of our first probably 4 or 5 outbreaks, I would estimate, and this is very conservative, but at least half of the staff, that's 50%, were either out because of COVID or they chose not to work at that particular facility any longer for fear that they would bring the virus into their home, where they may have family and children or extended family living with them. So we went to the first outbreak the day after it had been reported, and the administrator and the director of nursing and people from their admissions office were all out on the floor helping to pass out trays for dining service because staff did not show up. And it was greater than 50% that did not show up. And it was part because it was so new, and we were all scared by the idea of a pandemic. But I will tell you that has improved over time. But you looked at where the number of staff in nursing homes were before COVID and where we're at now, there has certainly been a sharp increase. And when a building had active COVID, it became even more pronounced. And you think about it, that's a time where you need staff the most to care for residents who are sick, but we were seeing staff leaving. That is why the governor made available to certain facilities the use of the National Guard to come in and help bridge that gap from the initial outbreak until staff could be recruited. And that was very commonplace for our office to help try and work with the nursing homes in getting the help of the National Guard. And we did a lot of that communication.
Right, exactly. And would you, to what extent would you say that people living in our facilities had access to technology to help them overcome this isolation and the lockdown, so to speak?
Sure, that is a question that, let me break that down just a second, because before COVID, we did not really pay a lot of attention to whether or not facilities had extra cell phones for residents to use. We didn't check to see how many iPads they had in case the resident wanted to uh, have a one-on-one, face-to-face conversation with their loved one. And once the pandemic hit, that became a major priority. And we were really surprised to learn how little technology the facilities had for residents to communicate with their family or friends. And it became so important because that was really, for the first 3 months, the only real communication you could have with your family was either over the phone or one-on-one through the social technology is what I've deemed it, but FaceTime, even Zoom. There are a number of different platforms that can be used, but that was something we put a premium on. And I have to give a shout out to the Dayton Daily News because they were so helpful in recognizing this challenge and were more than willing to acknowledge and announce that there is this shortage, and we began a process of trying to recruit as many folks as we could to go around and find extra iPads or extra cell phones that we could then take to the facilities to use. And we did that for at least 100 different facilities that we were communicating with. Now, not all 100 needed ultimately the technology we were able to get because they had found it from another source. But that was a big priority early on. And thankfully, by about June or so, there was a real streamlining of technology in most facilities where residents could communicate with family face to face. It wasn't as frequent as we would have liked. It was ideally we would have it every 2 to 3 days, but starting off it was once a week that they could make an appointment really to use the iPad to call family, and then they would limit it to half an hour. And they had from Monday until Sunday, they had every half hour blocked with calls to be made. So it was neat to see how that evolved. Wish it would have been under much better circumstances, but people came together with that.
That's good. What kind of additional training did the staff in the facilities receive in order to deal with COVID?
I know that there was a great deal of training for nursing home staff and really any entity or individual that was going to go into a nursing home on using personal protective equipment or PPE. The idea of putting on the equipment seems like it would be easy. You don't have to have lesson in how to put on a mask, but actually it is much more complicated than you would imagine. And you have to have a lot of options available because the gowns that are used are not one size fits all. We have to get different sizing. The mask or visors that go over the mask, there was a great deal of training regarding that, and especially once they had the personal protective gear on, how did they then proceed to interact with the resident? And PPE was probably the one type of training that was seen across all facilities, as well as even our office. We had extensive PPE training. And then, of course, for COVID itself, there was training. Just about every order that came out from the Department of Health or the governor, there was a component that the facilities would have to be trained upon. How do you screen visitors when they come in the facility? What does that look like? When you have outbreaks like we have had, how do you report that? What's the process? I mean, prior to March of 2020, if you told a facility that they needed to report a future outbreak, they would say, to who do I report it? How do you want it? And so that coronavirus dashboard that we talked about earlier, that was brand new technology, and the information that went into that, there was training from the state to the nursing homes, and anyone that was even remotely involved with facilities had to learn how this reporting system was working. So, and I've just scratched the surface. There's a lot of training that has gone on.
Okay, well, that's very how we as ombudsman had to change our advocacy work in response to the pandemic and the COVID. Our method for advocating is to always see the client, visit the client. And then all of a sudden, one day, we're told you can't see the client anymore. You can't see the resident. You can't go visit them and talk to them about what their concern is about their care or whatever they need. So that would be one of the first things that we had to change. We had to change our method of operation. Why don't you say a bit about that for the viewers?
Sure. That was very difficult. It was akin to, you want to go to an ice cream store, but they're out of ice cream. I mean, we did not have the ability to go in and meet with our clients face to face to advocate on their behalf. And it is so strange, and I'll just let the viewers kind of behind the curtain a little bit. We try on every case that's open to have a minimum of one face-to-face interaction with the client. Normally it's much more. So to take that part of our work away was challenging, but we understood why the need was there to minimize the risk to the residents. However, we still needed to communicate with residents and let them know we're here and find out what's going on. So we did it kind of a two-pronged approach. We called residents in facilities and we called family of residents. Now, how did we do that? We first had to call every nursing home and every assisted living facility and ask them for a current, up-to-date list of all of their residents with all of their uh, room numbers, and if they have phones that ring directly into their room, that number. Then we also had to ask for the family contact list for every resident in every facility. And that process of just gathering that information was very time consuming. And we have some of the greatest volunteers in our office that helped a lot with that work. And we have interns as well as staff. I mean, we were all gathering this information. Once we had it, then we started the process of calling every resident that we could communicate with. And if we couldn't get a hold of a resident, we would get a hold of their family member. Sometimes we got a hold of both. And we would ask the residents, particularly, how are they doing? How is life in the facility going for you? Do you have any complaints, concerns? We would ask the same of family, but what they witness or what they have experienced is often completely different than the resident. And they focused a lot on the families were all concerned about the lack of oversight of the facility. They were worried about staffing. They were worried about whether their loved one was interacting enough with other individuals because they may have already been down in the dumps and depressed, and this would be something that would push them over the edge. So a lot of concern. And we were, in essence, reaching out to every resident and their family, trying to find out from them what complaints they may have, what concerns, and even what have they seen the facility doing that they thought was good, that was helpful in the pandemic. And that is the volunteers that we have were instrumental in accomplishing that goal of getting every nursing home to provide the contact list and the family contact list as well. But, you know, in nursing homes and assisted living facilities, they are constantly changing their what their resident occupancy looks like, because new people are coming in, other folks are leaving. So we had to do this 3 different times so far to obtain this contact information, because we know whatever we gathered in May is going to be very different than what we gather in October, because residents have come and gone, new ones are there. And that has been really one of the primary ways that we have been able to stay up to date as best we can with the concerns of residents and their families.
Right. And do you anticipate that telephone contact and obtaining rosters of residents will continue into the future now that we've started it?
Absolutely, because we have learned that a lot of times the families are in the dark about what is taking place day to day. They didn't know that about, say, the Ombudsman's office. They didn't know that they were able to have input into the care that their loved one may be receiving. It is something that has come out of the pandemic that is going to be a change from the foreseeable future. It is not going to end. We may not do it as often, but we will certainly do it at least on a probably twice a year basis, because keeping that level of contact with the family and the residents, we also start to build more of a relationship with the client, and we're able to really get a individual's input, I think, more frankly and honestly, because they know we're not just popping in for the first time. This is something that we've really benefited from. And in fact, I'm going to say, not never, but most, we're going to try and do this before each visit to residents as well, making the initial contact with the family and the resident even before going in, because we have learned much information about each individual that it really has helped us as we've gone to work the case. That early information we receive from the calls has been invaluable.
Yes, good, good. So you've mentioned that the volunteers who used to, before COVID, visit the facilities very regularly. Many of our volunteers would visit two different facilities, often as much as once a week, to get to know the residents and to know what their concerns were and what changes they wanted. And then they went into action to get lists of residents, and they have helped us with that outreach as well, to call family members, right?
That's right. They have been a huge part of that.
Okay. So what other responses did we have to make in order to change our advocacy? We often are calling for a lot of care conferences to make sure that the plan of care is correct and that it's being followed and that everybody understands it. So we've had to change that because we can't get into the facilities to meet in person. I don't know if you'd like to say a little bit about that. Another thing that we're very active in is in discharges, when people receive a discharge notice. So those two things, the care conferences and the discharge notice, if you could address that a little bit about what techniques have changed with the advent of COVID in our work there.
Well, I will say first, care conferences are something that are in, if you have a loved one in a nursing home or assisted living facility, that's something that should happen every quarter. And if it doesn't, you can request that take place. Well, as ombudsman, when we would have a complaint, and a frequent complaint would be the failure to timely respond to call lights. A resident is in their room, they need help going to the bathroom, and they would hit their call light, and hopefully someone should within 5 minutes, but we've had complaints where they have gone 90 minutes, 2 hours, even longer, waiting for that call light to be responded to. And during a care conference, that would be one of the issues that we might raise, especially if it times up with when the complaint came to the office. But it is very much a part of the normal day-to-day world of nursing homes and assisted living, the care conference. And it's a tool that we as ombudsmen use frequently. When we're not allowed in the nursing homes, how do you participate in the care conference? Well, we go back to the technology. We were able to help facilities obtain iPads. Many facilities went and purchased a lot of this technology on their own. But through their investment and our ability to help get some of this technology in the nursing home's hands, we were able to then ask, whenever there was a care conference, that we be permitted to attend by way of some sort of connective device where we could participate, usually we would use Zoom or FaceTime, and a meeting would be set up, or we'd pop right in on a cell phone through FaceTime, and they could see us and we could see them. And I'll never forget one of the early conferences we had. There was an issue about space in the shower where a resident had fallen, and we were trying to come up with a different location where there might be a bigger shower. And the nursing home kept saying, no, this is big enough for the resident. We don't need to go to any other drastic measures of trying to wheel the resident to another area for bathing. Well, I asked, could we see the shower? And they walked down the hall with the iPad and into the shower, and we were able to see it. And one of the staff demonstrated by getting in the shower and showing that the room that they had. And one of the biggest problems was that there was a built-in bench that came out and protruded where they could sit and still shower. But there were other showers that did not have that bench. It had the rails, handrails on each side. And we were able to ultimately switch to one of those showers without having to go to another building. And the resident was able to do that. And that is just one example. I mean, we've had cases where we go around the facility looking at call lights because we want to know whether they're responding quickly enough. And we have called and talked to a staff member and asked them to go to hallway 3L, and we'll see if any call lights are on, and they'll walk us down the hall and show us what's there. So that technology has really been vital in helping us still advocate on behalf of the residents. You mentioned discharges and discharge hearings. That is something that we spend a lot of time as ombudsman working for residents and trying to keep from being involuntarily discharged or kicked out of the facility. Normally it's a payment issue. Sometimes it can be other issues such as behaviors or medications. Nonetheless, the nursing home has told the resident, we are no longer going to be your nursing home. You have 30 days to find a new home, and at that time you will be discharged. We are the ones, the Ombudsman's office is the primary defense for the residents. We are the ones that advocate that if the resident doesn't want to leave or they don't think they should be discharged, we will fight on their behalf. And that process of trying to overcome a discharge is done through a discharge hearing. And normally that's at the nursing home with a Ohio Department of Health hearing officer. And then the facility is on one side of the conference table, we're on the other, and we have an informal hearing that usually takes anywhere from an hour to multiple hours, depending on the issues. But not being there is very challenging to have the hearing, because a lot of times you're not just listening for the words, you're reading body language, you're looking at a lot of different components to the hearing. So we started initially when COVID hit, the hearings were all done by telephone, and we would have conference calls for those. We now have hearing officers who are absolutely refusing to use telephone. They will do it by conference, like we are doing here today on a Zoom call. that is precisely how we would have a discharge hearing. And the different technologies that are out there really make it seamless at this point to do, so long as everybody has a decent Wi-Fi connection, which can be challenging the more rural you go, the more challenging the Wi-Fi can be sometimes.
Right. We only have short time left, and I've got a couple of questions out there that I'd like to get to you. So maybe we'll have some quick answers so I can get more in the little time we have
You
left.
got it.
Okay. One is, did they did what does the governor announce today? The importance of the governor's announcement. You might want to summarize that very briefly.
Today, there was an announcement that assisted living facilities are going to have not just in-person visitation started again. They are going to have in-room visitation, which means family members can come to the facility and go to the resident's room, whereas right now they may be doing that in a conference room setting. Big step because it gives privacy to the residents, and so long as residents have been vaccinated, and most have, almost all that are currently in facilities have been fully vaccinated, which means they've had both vaccines, both doses, and there's been 14 days since the last vaccine.
Right, exactly. Another viewer is inquiring whether children can visit residents in nursing homes at this time, visit their grandparents, for example.
Right now, the visitation guidelines are followed that the governor and the Department of Health have put out. I would say that children coming to visit grandparents, as long as there is in-room visitation allowed, children should be allowed. However, they are going to be permitted to restrict the number of visitors at any one time. So if you're going to see a loved one, it may be that 2 is the most visitors allowed at one time. So you could take one grandson in to see the grandpa and then have to come out and then get the granddaughter to come in and see. You may have to do it in shifts, but again, this is just temporary, and we're doing it to make sure our brothers and sisters are safe. That's really what we want to make sure happens. And you may have to do it in shifts, but that's a small price to pay for their health and yours.
Okay. And what kind of proof of vaccination is being asked for of visitors? If a visitor's wanting to come in and says, I have had all the both sets of the vaccinations, what proof are the facilities asking for?
At this point, I am unaware of any proof of vaccination that is required for family members or anyone visiting. The facilities in the state of Ohio are more concerned whether or not the resident has been vaccinated, because assuming they were successfully vaccinated, their risk is greatly reduced. And if someone's coming to visit them, as far as we know at this point, there's no requirement that they provide proof of their vaccination status.
Right, because the facilities are mainly concerned about the people in their care, but that's the fear of having visitors in, that they're going to bring disease. Well, we're almost out of time. So do you have any closing remarks you'd like to make very quickly, Chip?
Just we are so close to the end of this pandemic in terms of what restrictions are in place. And it is right now, it's so close that you want it to be here. And I would say that follow the orders that are put out there. Know that this is for the best interest of the residents. And I would also say anybody that is inspired by the idea of helping folks in nursing homes and assisted living facilities, call us, because we have a great volunteer program, and our volunteer coordinator is one of the best, if not the best, in the state. And it is such a rewarding experience. If someone's looking to fill that need for volunteering, call us, because this is such a worthy endeavor that we are doing every day to advocate for the most vulnerable.
Thank you so much. And yes, I want to stress that if anyone is interested in volunteering with our program, please contact us at 937-223-4613. I want to thank all of the viewers for the questions that they called in. We appreciate that, and thank you for watching. And so then we have to bring this to a close. So thank you very much.